Big Cat Rescue provides a permanent home to over 100 rescued exotic cats, such as lions, tigers, leopards, and much more. Two of our more unusual residents are brothers, Tonga and Pharaoh. They're actually white servals, and to the best of our knowledge, are the only two in the world. As you can see, servals usually have a golden coat with black spots and stripes, but Tonga and Pharaoh have almost completely white coats. However, they're not albino since they do have some dark spots and also blue-green eyes. White servals are not an endangered species, but actually possess a genetic defect that would prohibit their survival in the wild. They would be unable to camouflage themselves and would face certain death, since they'd be unable to sneak up on prey or hide from predators. The white coat is the outward indication of the detrimental effects of inbreeding, just like albinos. Tonga was born at Big Cat Rescue in May 1997. Back in the 90s, we bred some cats under the misguided notion that we were helping to, in quotes, preserve the species. We had not figured out what seems so obvious to us today, that breeding for life in a cage is inherently cruel. Tonga was born to parents Frosty and Nairobi, who have since been spayed and neutered. We didn't know at the time, but they must have been closely related. In the wild, and in most other captive situations, servals only live to be 10 or 12 years old, but at Big Cat Rescue, they have an average lifespan of 17. Thankfully, Tonga's adult life has been pretty uneventful from a medical perspective. He had a bad tooth extracted in 2010, and he had an abscess treated on his leg in 2011, but his blood work has been pretty much routine for an elderly cat. When keepers noticed that Tonga had an abrasion on his nose, it was treated with antibiotics and subsided, but unfortunately recurred 6 months later, this time looking much worse. So despite the danger of sedating an exotic cat, we decided to do a full exam on Tonga to determine the cause of the sore in his nose. Tissue samples from the wound were sent to the lab for testing, while Tonga was started on a course of antibiotics and remained in the cat hospital. Unfortunately, the test discovered that Tonga had cancer, but now we knew the cause of the wound and could decide upon the best treatment. After many tests and a full CT scan of Tonga's head, it was determined that the cancer had not yet spread, and his team of doctors recommended a nosectomy in order to give Tonga the best chance possible at beating the cancer. It's always extremely hard to decide the best course of action in situations like this. The delicate surgery will cost thousands of dollars. Tonga could die during the procedure. He could have a recurrence or have the cancer manifest in other organs, and he may live a few weeks, a few months, or a few years. We just don't know. What we did know is that we had to try. When removing Tonga's nose, the surgeons had to take a full centimeter extra around the cancerous mass to make sure all the cancerous cells were removed. The surgery was a great success, and Tonga spent the next few weeks recovering in the cat hospital before returning to his outdoor enclosure. Tonga's skin has completely healed over, and the cancer does not appear to have spread into his brain or nasal cavities. He's enjoying life outside once again, appears very strong, and he's always ready for dinner. Once again, we'd like to thank our generous supporters for helping us provide the best care possible for our residents.